This exam application tutorial is on the topic of glucoregulation. The question for 6 marks: explain how type 1 and type 2 diabetes are controlled. So there's a natural division in this question. Part of it is on type 1, part of it is on type 2. The translation would be: state the cause of each type of diabetes and describe how diabetes is controlled. The good news is that you control type 1 and type 2 diabetes using the same methods. So, what causes type 1 diabetes? Well, type 1 diabetes occurs when the pancreas, that organ which feeds into our small intestine, stops producing insulin. Type 2 diabetes occurs when organs become resistant or stop responding to insulin. So we can still make insulin, but our organs have stopped responding to it. It's worth mentioning that type 2 diabetes is strongly linked to obesity, and that kind of logically makes sense. If your organs are surrounded by layers of fat, then it's harder for insulin to do its job. Now, both forms of diabetes can be controlled in the following ways. Firstly, regular injections of insulin into the subcutaneous fat. That's the layer of fat just below the skin. Cuticle's the surface, sub is just below, so below surface fat. Also, diabetics can control their diabetes through their diet, so by controlling their diet, specifically looking at their sugar intake. And also, they can exercise regularly, so diabetics can control their blood sugar level by exercising regularly, because obviously we use glucose when we exercise for respiration. So all we've done is explain what type 1 diabetes is, what type 2 diabetes is, and how we control both of them for 6 marks.